So it gives me great pleasure to introduce Laura Wandner. Let me tell you a little bit about Laura, besides the fact that she's an NIH program officer. Laura is actually one of us. She's trained as a pain psychologist. And Laura is a wonderful example of someone that works at the NIH that's been incredibly impactful. Even though it's a massive organization, she's been incredibly impactful because she has continued to push forward the need for the HEAL initiative, which in the NIH is funding a lot of additional pain and opioid research, really double down with respect to training programs. So Laura not only is directing a lot of these programs, but behind the scenes, behind the Wizard of Oz curtain that she's going to tell us a little bit about, she actually has been really the major champion for these programs. So again, as you see more and more of these HEAL training programs, those of you who are in the K-12, this is very much Laura's baby. The T90, R90 grants that have just been funded, the new K-23s that she's going to talk about, this is all Laura. This is all because of a single person who has taken it upon herself to take a role in a massive organization where sometimes people feel lost and like they don't have an impact, and she's had an amazing impact. So we enjoy working with Laura. She is extremely serious about training. So thank you, Laura.
Well, thank you, Dan. I appreciate it. And I really enjoy working with all of you, and it's been wonderful being here at this short course and just hearing all of the talks. It's great to meet the trainees in person. This may not be the most interesting of talks, especially after the last conversation we just had, so bear with me. But I'm Laura Wandner. I'm a program director in the Office of Pain Policy and Planning, and I'm going to be talking to you about some of the ins and outs of NIH. And so we'll talk a little bit about NIH resources, how to talk to program staff, why it's important to know institute priorities and how to find institute priorities. And then we'll talk about HEAL funding announcements, but I am going to be a little bit of a broken record also, is that HEAL is a big game in town. HEAL is funding a lot of research, but the institutes are also funding research still. So I really want people to be thinking about submitting their Fs, their Ks, their Rs to the institutes to have that innovative research going out there as well. So when I was here last year at the short course, I remember that we really had people across the career spectrum. So when I was preparing this talk, I wanted to think about what are some resources across the career spectrum. And so one resource that I think will be helpful for all people is the NIH Research Training website. It was launched in 2015, and it's a one-stop shop for funding opportunities, but it's also a useful resource for trainees, postdocs, potential K awardees, and early-stage faculty. And on that website, they'll have kind of a career path. So the example that I have here is if you think you're pursuing a career as a PhD, what might be some of the grant opportunities that you might have along the way. So for example, while you're in college, you could still apply to a summer NIH R25 program. And then once you're in graduate school, you have different opportunities like the T35, for example. And then after graduate school, you have different opportunities for postdoctoral research, and these are not exclusive opportunities of careers. There are other career paths. But then once you get into your postdoc opportunity, you still have your T32s, you have your K99 R00s, and then you become a career as a research scientist, and you have different career paths, and then different grant opportunities open up to you, such as the U's and the R's. So if you think about from like an NIH funding for training and career development, especially if, say, let's talk about postdoctoral to faculty, a lot of the opportunities are going to be in that career development award and loan repayment space. And what we've found in our portfolio analysis is people who've had career development awards and loan repayments have had better outcomes in some of these areas. And so I know that I've provided a lot of information, so I want to provide it in a different way for you guys to visualize what are some of the grant opportunities that you have if you're pre-doc and postdoc. And then if they're early career, a transition award like the K99 R00, the Career Development Award, diversity supplements, and as an independent investigator, you have your research awards, your Rs, your Us, and your loan repayments. This can also just be a lot of jargon, so if these terms don't make a lot of sense, please feel free to reach out to me afterwards. Also on the NIH website, they have a list of like what is each mechanism, and you can click on it to get an explanation of what it means. So another good resource that I think most people should know about is the NIH Grants YouTube channel. They put up a lot of useful resources about small businesses, data sharing, how to apply for a grant. So it gives you a lot of tips and tricks to kind of get inside NIH's thinking, so it's a good resource to be aware of. And then NIH, like most organizations these days, has a lot of podcasts, and some of the podcasts that might be relevant to this group is NINDS's Building Up the Nerve. They have episodes on technical how-tos and soft skills, so they've had episodes on how to write grants, they've had a season on mentoring, and then NIH Central has an NIH All About the Grants podcast, which really has the ins and outs of how to write a grant. So if you are new to grants, these could be good resources for you as you're trying to write your grant opportunities. And then another good resource for the community is the Scientific Workforce Diversity website. There's a lot of great resources on the website itself. They also have a blog and a newsletter that you can register for and get information from. So that may be of interest to people in this group. The Common Fund also put a lot of money into the National Research Mentoring Network. It's a national mentoring network across all career stages in the biomedical, behavioral, and clinical and social sciences. So if you're looking for a national mentor who may not be at your institution, you can join this network and try to get a partnership outside of your institution. So if you have any interest in that, or you know other people who might be at under-resourced institutions and are looking for mentors, it may be a way to connect them to new mentors as well. And hopefully everybody in this room knows about the Purpose Network. If you don't, it stands for Positively Uniting Researchers Pain to Opine, Synthesize, and Engage. NIH funded this really to connect pain researchers across the continuum of pain research from all disciplines and at all career stages. And so we're using it to run a digital platform and organize and run an annual meeting and really build a community and offer ongoing webinars and trainings, provide multidisciplinary collaborations, and aggregate information such as funding announcements and job opportunities. NIH has been posting a lot of information here, so if you kind of want a one-stop shop to get information, it's a really good resource. Jacob Coverstone is the PI, and he's here, so if you haven't had a chance to talk to him, please take a moment to speak with him as well. And then another resource for the pain community is the NIH Pain Consortium. The NIH Pain Consortium is basically program officers at all of the institutes at NIH who fund pain research. And we meet quarterly and discuss research and pain priorities and think about what's needed for the pain field in the future. And so we post some of that information then that we can talk externally with the community. So it's information that you can look there for that information. We also run an annual symposium once a year. It's typically in the summer. So we'll post when the next meeting is on that. We just had one on sex and gender differences. And then one of the resources that the Pain Consortium released within the last year and a half was a grant mechanism webinar series where the goal of this webinar series was to inform the pain research community of funding opportunities and other resources at NIH. So you can get some of the archived videos and they'll talk about clinical mentoring, early career grants, how to build a budget, and you can see some of those questions and answers that people had because those are all archived as well. A really important website for not just new investigators, really all investigators, is the NIH Reporter website. So I think we all kind of are sometimes a little bit, we talk about this blue in the face. So if you guys have heard this at other talks, I'm sorry. But the reason why we really highlight NIH Reporter and Matchmaker is that it's a tool where you can enter your abstract, key terms, or scientific text into this matchmaker, and it will pop out a list of similar projects that have already been funded. So you can look for people who you might want to collaborate with in the future. You can get a sense of what institutes have funded similar research, and you can get a sense of what funding mechanisms were used in the past. So that might give you a sense of, should I be applying for an R with this? Should I be applying for a cooperative agreement? What study section it went to, so you can get a sense of who might be reviewing your work. And then importantly, it also provides a list of program officials who are associated with those projects so that you can then reach out to the program officers and ask them to provide feedback on your aims. And so the last resource that I want to quickly talk about is the NIH Extramural Loan Repayment Program. If you guys don't know about this, it's a great way to get some debt relieved. So the NIH Loan Repayment Program is a vital component to the nation's effort to keep our healthcare professionals in research careers. So you are committing to 2 years of research, and the NIH can repay up to $50,000 a year of qualified educational debt, with the idea of hopefully keeping more people in research. Applications are due every November, so we've got an upcoming receipt date coming. So if you have the time, I would consider applying to the loan repayment program. The loan repayment office is very friendly. I would recommend reaching out to them to ask questions. We also had a Get to Know Your IC webinar series on purpose about the loan repayment program recently. So if you want to watch that webinar, it may give you a little bit more information about the loan repayment program. Okay, switching gears, how to talk to NIH program staff. So basically, how do you talk to people like me? So I'm a program director, and so we have scientific expertise in the field, and we manage a variety of grant mechanisms that includes cooperative agreements, and we identify research gaps and develop concepts that we then publish. It could be IC specific, I am at NINDS, or it could be trans NIH, it could be across HEAL or the Common Fund. And then we reach out to the investigator community, so we come to workshops like this to try and meet you and answer your questions. We try to disseminate findings. We serve as liaisons and representatives to other research organizations. And then a key purpose is really to build relationships with PIs and new PIs, help people get funding initially, and help people get their next grant. So you really want to develop those relationships with program officers who are in your field, in the scientific field. So I want to give a couple of tips of how to successfully talk to a program staff. So pre-application, it's always great to send an email and include the specific notice of funding opportunity that you are applying to, or if you're coming up with a new idea saying that you're applying for an R or a K. Write a brief description about yourself and the project idea, any specific questions you may have for us, and I would always encourage you to attach an aims page. We can always have a more in-depth conversation if you have your aims page attached. And then when you actually have the conversation, you're welcome to get on the call alone. If you have a mentor, you're welcome to bring your mentor on that call as well. And you might discuss the fit of your aims with those IC priorities and the fit with the notice of funding opportunity that you're applying to. And then post-review, so after an application has been reviewed, I would encourage you to read your summary statements and discuss it first either with your mentors or with your colleagues. Then email the PO to request a discussion of the critiques and potential for funding or resubmission. And then you might want to write a response to the summary statements. So another way to kind of visualize this timeline, because it gets kind of confusing, is that pre-application, you can email our POs several months ahead of time to request a call. I know that HEAL does not typically allow several months. It may be like a couple of weeks in that case. But email us in advance and then discuss the fit of the scientific priorities. Once you get to the application, once it's in review though, you cannot talk to program staff at that point. At that time, you've got to talk to the scientific review officer. They're the ones who are going to help review the grant. And so you can email them as needed to request a call, and you can discuss the fit of an application with the study section. You're allowed to talk about post-application materials. Once the summary statement has been released, it's got to be at least 1 day after the summary statements have been released, then you can request a call with your program officer, and you can discuss the critiques and potential for funding and potential for resubmission. So, kind of summarizing all this together, before you apply, please try to contact us early. Give us questions about your research idea and grant mechanisms and any NIH policies you have questions about. ID any potential funding opportunities and application procedures. We can talk about the review process and the committee that it might go to for review or study section. We can think about new initiatives and research ideas. We're more than happy to talk to you about your career development plan, and we can discuss the fit with the strategic priorities. And then post-application review, program officers can really only discuss your application after the summary statements have been released. So you can discuss reviewers' comments and the ways to respond to summary statements. You can discuss the impact and priority score and the potential for funding. And then you can discuss next steps, kind of pre-award procedures and revisions and other ideas. So really the summary of this is like, don't be shy. We are also sometimes busy, so you may need to email us a couple of times. So don't hesitate. We're sometimes at meetings like this or something gets under our, just gets stuck in our email. So please email us again. Program officers really do like talking about science, so please reach out to us and talk to us about the science. But I would encourage you to do your homework and be prepared for the conversation. That will enable that conversation to go a little bit more smoothly, but we're here to help. And so if you want to know more about the process of when do you talk to the program officer, the scientific review officer, and the program officer again, and about summary statements, the annual purpose meeting had a session on understanding review summary statements. So you can go to the purpose website and watch that discussion with a couple program officers and an SRO to have that conversation. Okay. So we're going to switch over and talk about institute priorities. A lot of the research that's getting funded still within the pain community is happening at the institute level. So it's important for you to have an understanding of what is an institute funding and what type of pain research they fund. So this is the example on the NINDS website where we have a website that says what we are focusing on when it comes to pain research. And so you can think about submitting grants to institutes like training awards, career development awards, Rs, et cetera. And so there are different ways to get to know what an IC is funding. One is to contact the PO and talk to them about what are the strategic plans that are happening at that institute, and what are the priorities of the branch, because even a branch has different priorities and program officers have different interests. The Purpose Network has, as I said, a Get to Know Your IC webinar series, since it is kind of confusing to get a sense of what are the institute priorities. So you can go back through archived videos to see what does NCI tend to fund in pain, what does NINDS fund in pain. So those would be good resources as well. And then the NIH Pain Consortium webinar series on how to write good grants also has some conversations about what are the IC's funding. So that could be another resource for everyone. So it's really, the takeaway message here is it's really important to find a home for your research. So you can review the strategic plan and scientific priorities of institutes and centers, and you really want to match up your science with an institute. It may fit into more than one institute, so in that case, you may need to talk to more than one program officer to see if your research fits into that IC. And then you need to get an understanding of how the different institutes operate. So there may be specific funding opportunities that they do or do not fund. So for example, at NINDS, we do not fund the mid-career K-24. So if you're looking for that opportunity, you're going to need to look for a different institute. Their branch-specific priorities, their program staff interests and funding strategies, and then their IC-specific resources and blogs that you can look at that can be helpful. So I'd encourage you, if the IC has emails to sign up for, it could be a good way to get information about that IC. So for example, the NCCIH, or other people in this room call it Nikki, has a website that has the funding priorities that you can click on. They have the open RFAs, they have the grant application resources, and then you can subscribe for the email, subscribe to their email listserv to get information. So this is an example of where everything's clearly located. It's not the case for all institutes, but this is a good example of one. So, okay, last quick area of focus. I know I've been saying focus on institutes. I still want you guys to think about submitting your grants to institutes, but HEAL does exist, and we have a lot of open funding announcements. And so I also want to highlight what open funding announcements are available to you guys right now within HEAL. I am not the PO on all of these, but I will have the PO listed, so if you have a question, happy to try to answer it. We can also direct you to the PO who is listed on the slate. So quickly going through these, we have the Pain Therapeutic Target Discovery Validation Program. This program is trying to promote basic discovery and validation of targets that can be used to develop treatments for pain that have little to no abuse or addiction liability, and enable future translational research in the development of non-addictive pain therapies. If this is of interest, the point of contact is Michael Ochinsky, and his email is listed here on this slide. A lot of these first dates are coming up in October, so they're quickly approaching. I think you're going to see October, November are the first receipt dates for a lot of these. The next one is understanding individual differences in human pain conditions. It supports research aimed at understanding between person differences in human pain condition and focusing on whole person health. The leads for this is DP Mohapatra and Sarah Waller. So if you're interested in this topic, please feel free to reach out to them. The development and validation of animal models and outcome measures for pain. The scope of this is really looking at in vivo models and clinically relevant outcome measures that reflect human pain conditions and enable the translation of effective pain therapies. Program contacts here are Becky Roof and Julia Bachman if you're interested. And then we have the preclinical screening platform for pain. Their mission is to accelerate the discovery and preclinical development of non-opioid, non-addictive treatments. The contact here is Smriti Iyengar, so please feel free to reach out to her if you're interested. The HEAL Initiative Early Stage Translational Program. The goal here is to support early therapeutic discovery to advance a hit or a lead asset to the point where it can meet the entry criteria for the PDDP program. Point of contact for that one is Julia Bachman. Program that I'm very excited about is the National K-12 program, which is housed here at the University of Michigan. So the goal of this program is to support the early career pain management researchers by developing a structured mentoring and career development program. And the goal of this program is really to ensure a diverse pool of highly trained clinicians that are able to expand and enhance the pain management workforce. So next round of applications are going to be due wintry of 2025. Our PIs are here, Dave, Dan, and Steve. They're doing an excellent job leading the program. We have our first scholars that are here and our second class of scholars, and we're going to be hearing from them in just a little bit. So very excited for the work that these scholars are going to be doing over their career. So very excited to have them. A new program that I was hoping to announce who the recipients were going to be, but I can't because not all the notice of awards are out, is the Pain Cohort Program. So the goal of this program is to support interdisciplinary postdoctoral training to promote the next generation of independent clinical pain researchers. So we are planning to fund about 4 to 6 T90, R90 postdoctoral training programs to really foster a cohort experience, and that purpose is going to help with that cohort experience. We'll expect that the postdocs will be recruited kind of fall of 2024, winter of 2025. So researchers who are interested in this postdoc opportunity can reach out to the points of contact We obviously don't know the names of the points of contact at the moment, so for now you can reach out to me if you're interested or know anybody who's interested in a postdoctoral opportunity, and once all of the notices of award go out, we will make an announcement to say how many and which institutions were funded. We also have a coordinated approaches to pain care in healthcare systems. This notice is embedded in a coordinated care model and studying the healthcare delivery system of an applicant's institution. And it approaches, proposed studies are expected to include interventions from multidisciplines and should aim to improve pain management based on the biopsychosocial model of pain. So this is being managed by Linda Porter and Marlene Peters, if you have any interest in this program. Okay, just a couple more. We have the Postdoctoral to Independent Career Transition Award for both pain and substance use disorders. There are 4 different NOFOs for this. The goal is to increase a cohort of new and well-trained independent investigators conducting pain and SUD research in the clinical trials not allowed space and the BESH space, and standard awards as well as diversity awards. So if you're interested in this opportunity, please feel free to reach out to either DP Mohapatra or Elizabeth Sipek. And then a program that I'm very excited about that just got released last week is the HEAL Career Development Awards, the K-12s and K-08s. The purpose of these are to support the career development of individuals with clinical doctoral degrees, and this program will provide support to early career phase investigators and research areas supported by the HEAL Clinical Pain Research Mission. So we have 3 different versions of the K-08, so clinical trials required, BESH, and clinical trials not allowed, as well as the K-23. If you or somebody as one of your trainees is interested in this program, really what I'm trying to highlight for people is that we know that pain crosses disciplines and crosses institutes a lot of times, so it can be sometimes hard to find a home for your research. So if your career development award does not fit into one institute missions, then this would be a good program for you. Okay, last quick comment is that HEAL is going through strategic planning right now. You may be hearing more about this over the next couple of weeks to months. I really want to encourage people in this room to provide feedback about what you think HEAL should be focusing on in the future. I know people in this room have ideas and things that have, maybe some things that have gone well. There's also been some challenges potentially, and there are ways and opportunities that it could be improved for the future and different just types of funding mechanisms. So if you have interest, we would really like you to provide a request for information. You can either submit an email with the heading HEAL RFI, or you can submit it through the portal that we have here. And with that, I'm happy to take any questions.